we welcome veterinary pharmacologist Dr. Stephen Page to discuss appropriate use. Stephen spent 5 years at the University of Sydney rural practice at Camden and then worked for and consulted to most of the global animal health pharmaceutical companies. He was involved in the development of new veterinary medicines, both pharmaceutical and biological, for companion animal and livestock species, and in the technical and regulatory support of new products. His particular areas of focus include clinical pharmacology, clinical toxicology, risk assessment, and food safety. For much of the last decade, Stephen has devoted most of his time to the appropriate use of antibacterial agents, which makes him the right man for the job this morning. Please welcome Dr. Stephen Page.
Well, an absolute pleasure to be invited to come and talk to you this morning. And I must admit, I really enjoyed Peter's presentation. There's been no collusion. I just sort of caught up with him this morning and we're having a bit of a chat. So there's no way that my slides could have been influenced by our discussion, but I think you'll be as amazed as I am that there's a lot of common messages and themes. And I don't think that that's necessarily totally a coincidence, because I think whereas Peter mentioned the importance of One Health, that's something that I believe in as well. And I think even though we're coming from different perspectives, the messages that we're conveying are very, very similar. So I think if there's any overlap, then think of that as reinforcement rather than duplication. So I'd like to emphasise a few points in opening, talk about the inexorable rise of antimicrobial resistance, maybe a couple of words too, just extending the theme that was introduced previously about this antimicrobial crisis, and maybe comparing the human medical crisis versus what's happening in livestock, and particularly, what's happening in feedlot cattle in Australia. How much of an issue is antimicrobial resistance. I'd then like to go into a couple of other subjects and highlight the importance of behaviour change in this whole topic of antimicrobial use and how it might influence antimicrobial resistance. Because what's amazing, and hopefully you'll also be amazed as we go through this particular presentation, is that the answers to a lot of the problems that we have at the moment in this area have been well known and understood for probably over a century. We knew the answers before we even had antibiotics, yet human behaviour still drives us to use a lot of these very valuable tools in an excessive way. So unless we understand sort of human behaviour, we're not likely to ever come up with a solution that's going to be effective. And then finally, to talk about where cooperation as we go forward can actually make a major contribution to alleviating this crisis that we're currently facing. So just to put it into perspective, just a couple of quotes from earlier this year. The first one from a report that came out on surveillance of antimicrobial resistance, so the first comprehensive global survey of antimicrobial resistance, particularly in the medical area, not in the veterinary one. And it was concluded, if you just look at the highlighted area, that maybe this issue of being in a post-antibiotic area in which common infections and minor injuries can kill, it's not an apocalyptic fantasy, they're saying. It's instead a very real possibility for this century. It's hard, we all seem very relaxed this morning, but we don't necessarily realise that every year it's estimated that in the US something like 23,000 people die as a direct result of antimicrobial resistant bugs. And in Europe the estimates are something like 25,000. If you translate those numbers to jumbo jets falling out of the sky, then no one would be flying. Yet we continue to use antimicrobials in much the same way as we have for the last couple of decades. So it is a crisis, but it's not your usual sort of crisis. This is almost a hidden crisis that's going on, and lots of people, including the previous speaker, have been trying to raise the world's attention to this important issue. And the other thing, and I've asterisked this because I think this is a particular important message, is that every individual's use of antibiotics contributes to loss of their efficacy over time for everybody else. And that's why I think One Health is very important. And anything we do, no matter how minor it may seem, we've got to assume that it'll have some impact. Maybe we can't measure it, but even just in terms of our own behaviour, we should always think very carefully about any use of antimicrobials, whether we're involved in administering it to an animal or, in fact, if we're receiving it ourselves. You know, we have to look at antibiotics as a very precious resource and a limited one, and take that into consideration, particularly in view of the fact that, you know, we all live in the same, on the same planet, in the same world, and anything that we do is ultimately going to have an impact somewhere else. And just to sort of emphasise this, I suppose, and put it into perspective, it's just sort of a fairly simple diagram, but it does point out that in terms of the sources of antimicrobial resistance, a lot of them originally come from the environment, and then they circulate. And you can see all those arrows connecting every part of the environment. And the parts that are particularly important, I suppose, is what happens to manure, what happens to water, and what happens to food, etc. You know, unless we actually balance the equation, we're not ever going to get on top of this particular issue. So anything we do in one part of that environment is going to affect every other part. Whether we measure it or cannot measure it, it's really not important. And to highlight what the post-antibiotic era might look like, we can look at the pre-antibiotic era. And so, you know, not that long ago, even less than 100 years ago, the son of the president of the US got you know, what today would be considered a fairly trivial infection when just playing in the garden, the president's garden. Pricked himself, got infected, and shortly thereafter he died, despite the best medical interventions of the time. So, you know, this is where we may in fact be headed, and so life would be quite different without antibiotics on a number of levels. And this is something that's real, you know, just as the WHO were quoted in that previous slide. So no one is immune, or no one's going to be able to avoid this if in fact antimicrobial resistance continues to grow and disseminate and become more prevalent than it is at the moment. And just to highlight another point from Peter too, I mean, they talk about at the moment that we're in this perfect storm where antimicrobial resistance continues to grow, particularly in the human area. And at the same time that we get more resistance, we've got fewer tools to treat it, so fewer antimicrobials. So to have these two things existing concurrently is in fact sort of a great recipe for this perfect storm. On the animal front, this is a headline from the Copenhagen press, I think, from earlier in the month, where they're talking about thousands are infected with porcine MRSA without knowing it. Up to 12,000 Danes are unaware of their infection with multi-drug resistant swine bacterium. So these are sort of the headlines that are coming up. There's not hysteria in the streets. I've just come back from a meeting on responsible use in the Netherlands, and quite a few people from Denmark were there. So despite these headlines and the hysteria that they're trying to whip up, people aren't necessarily dying of these infections, but it does highlight that there is this nexus between resistance in humans and resistance in animals, and there is the possibility, the potential for transfer in either direction. And in this particular case, you know, probably MRSA that may historically have had a human origin has now adapted to live in pigs. Danish pigs and Dutch pigs have a very high prevalence of this resistance, and those working in close contact with pigs particularly also seem to be carriers of this particular bug. It doesn't like colonising humans. Its residence in humans is fairly limited, but staffs historically have this keen ability to adapt. So what their behaviour today might be quite different to their behaviour in the future. And I think this has significance for Australia as well. Only recently was the first case of this particular MRSA identified in Australia, but we'll come on to that a little bit later. But also just raising this theme of the crisis, earlier this year the UK government sort of announced that we've got to do something about this global threat. And in fact the Chief Medical Officer in of the United Kingdom, sort of Professor Dame Sally Davies, went to the extent, and this is sort of how the information gets conveyed to the public via the media, she was urging vets to slaughter sick animals rather than give them antibiotics to help them recover. So messages like that I don't think are necessarily very productive. So I think, it was pointed out to her that she may have been misinformed, but this is the level of concern there is about this issue of antimicrobial resistance. So when you get sort of the chief medical officer of a very important country making statements like this, it really does need to grab our attention as to what the basis of those particular recommendations might be. A couple of weeks ago, the President of the United States put out his national strategy for combating antibiotic-resistant bacteria. That there are a number of chapters in this report. It's sort of freely downloadable and is an excellent read because the report to the President is actually a very good and contemporary summary of the issue. And then arising from that report is the national strategy. And a lot of that national strategy is looking at things like infection control and better use of antimicrobials, which are the theme of my particular presentation today as well. Most of the chapters are in fact about addressing the issue in humans. There is an important issue in a chapter on livestock. I found it quite interesting that there's not one mention in this whole report on the use of antimicrobials in companion animals. And my personal belief is that they are in fact potentially much more important source of exposure to resistance than livestock might be. But we'll be reading about that in the future, I'm sure. And of course, in Australia, we also have under development a national antimicrobial resistance strategy, which itself was sort of drawn on the findings of a summit on antimicrobial resistance meeting in Sydney several years ago with many veterinarians and medical infectious diseases, public health people attending, putting together an agenda for addressing this particularly important issue. One of the top journals in the world, Nature, sort of earlier this year, sort of also highlighted their three-point plan for antibiotics. And a lot of the messages that come out for one profession, if it's the medical profession, equally apply to animal health. So here they were highlighting the need for antimicrobial stewardship, and that's a theme I'll be exploring a little bit further. Also the need for diagnostics. To direct antibiotic use. And I think in human medicine, one of the great issues that's been identified is the absence of really good patient-side diagnostic interventions. And I think that's equally true in the veterinary area. If we had more accurate means of diagnosing infection on an individual basis, then you could actually selectively treat animals much more efficiently and effectively, and that was bound to have an impact on the amount of antibiotic use that there is. Because a lot of the technology that's being used to develop these patient-side diagnostic tests is very expensive, but it is dropping in price like many other technologies. And I expect in the next 10 years there'll be a lot of benefits flow through from what's currently being developed for use in human infectious disease practice. And then, of course, new antibiotics. I think unlike the human space, I don't think we can look forward in our lifetime to genuine new classes of antibiotics that are going to be used in animals. And I don't know that that's necessarily a major problem because I think we can actually do very well with what we already have. Also highlighting this crisis is the report that came out from WHO earlier in this year, which was, as I mentioned before, the first global report on surveillance. Because if we go back to the pre-antibiotic era, this is sort of the time, the Middle Ages, when there were plagues, it wasn't necessarily a good thing to be a doctor in those days because that put you close to sick people. And if you're close to sick people, then you might become sick yourself. So to try and overcome that, and this was sort of very early human behaviour to interrupt infection transmission, to dress up in these beaked outfits. Can you imagine going to your feedlot and the vet turns up sort of dressed like this because there aren't any antibiotics and he's afraid of getting infected? But I mean, this is, what might happen. At that time, microbes weren't actually described. Everyone thought that bad odours were in fact the cause of disease. So this particular outfit was designed to sort of have sweet smelling things in the beak. But I mean, this is sort of, an element of sort of the future, I suppose, that we do have to concentrate more and more on infection control, and that's where I think there may in fact be a big difference between Medical practice and the raising of livestock, where everyone in this room who's associated with feedlots understands very well exactly how important infection control is and the consequences if you don't control infection. And not using antibiotics to control infection, but using a variety of other interventions. So what about this crisis in animal health then, and how it might apply to feedlot cattle? I think for many years, it's been a great reluctance to sort of have a look and see what the resistance level might be and collect information on antimicrobial use. And in the absence of any sort of solid information that's contemporary, it's often very difficult to answer the questions that inevitably arise about, the questions often are founded on stories that might come out of the US or Europe, where they do have significant issues with antimicrobial resistance and also excessive use of antimicrobials. So it's the assumption with no data is that Australia is as bad, if not worse, than other parts of the world. Well, the reality is in fact quite the opposite. And recently, MLA convened a meeting in Canberra to look at this issue of antimicrobials in the cattle industry, and it was really the first forum, surprisingly, that's ever brought the dairy, feedlots and grazing industries together to talk about antimicrobial use and resistance. And at this meeting, summaries of all the studies that have been done looking at resistance particularly were presented. And in fact, the situation is extraordinarily good. And I think it reflects a lot of things. One, the fact that we don't have the same variety of antibiotics that are used in many other parts of the world. And so if we're not using those antimicrobials like the fluoroquinolones, we can't get fluoroquinolone resistance. But it also reflects the fact that I think that we're not necessarily so dependent in production systems on the use of antimicrobials. Over recent decades, there's been greater and greater control on biosecurity and infection control measures. Because I'm sure it's true in all livestock industries that if you have an outbreak of disease, that sort of necessarily reflects back on some sort of significant management failure. So you don't really want to have outbreaks of disease, you want to intervene and prevent it, whether it's vaccines or better management, genetics, nutrition, whatever it happens to be, and environmental controls. You guys are the experts at doing that sort of thing for feedlot cattle. And just to give you an idea, I mean, this is just, if you look at the frequencies on the y-axis, a heavy level of resistance is 28%, and that's just to sulfonamides, which are rarely used and not necessarily considered of major importance in human health. So many of the resistances here are actually coming in at zero. The ones that are asterisk are those resistances that would be considered maybe of high or critical importance to medical practice. So this is just a snapshot of resistance in Salmonella, which is a potentially foodborne bug. So and also I don't have slides on other bugs, but the story is pretty much the same for E. coli and other enterococci. And even Campylobacters of cattle, which are much less common in cattle than they are in other species like poultry. So the situation looks pretty good in feedlot cattle. I'm not saying look at this and then be complacent. I'm saying we've got a really good base to build on. We can keep it that way. It doesn't need to get any worse. We can use the tools that we have available, and how can we most effectively do that? Now that we've got some baseline data and we can feel a little bit more comfortable about what the situation's like, I think most of the livestock industries are more willingly becoming partners of what's inevitably going to be introduced by the federal government, which is going to be this sort of ongoing surveillance of antimicrobial resistance and antibiotic use. The Department of Agriculture at the moment are considering a report on how it would be most effectively done. And so really it's just a matter of having the resources to implement it. I think the will is there, but maybe not the human resource and the financial resource to back it up. But I think we can expect that at a particular frequency that's proportionate, I suppose, to the degree of the problem, there will be ongoing surveillance of antibiotic use and also the antimicrobial resistance situation. So the theme I'd like to develop in the final third of my talk is how can we foster cooperation through stewardship? And I think what is stewardship? And I think you'll all be familiar with stewardship in a variety of other situations, whether it's sort of handling of pesticides and containers, managing the environment on farms, etc. And stewardship equally applies to the use of antimicrobials. So it's taking that personal responsibility for something that one does not own. And this particular case, it's sort of this, the social resource, I suppose, very important resource that's limited of antimicrobials. So the primary goal of antimicrobial stewardship then is really to optimise clinical outcomes while minimising use and resistance. And what I've highlighted here with the asterisk is that, going back to this theme of one health and a common environment in which we're all living, that because microbes and antimicrobials can be selected and disseminated from one place to another, stewardship must be applied at every level of society. And I think this is not just on the farm. I think once you've got the principle and the behaviour that becomes entrenched, it's got to be applied everywhere. In the home, hand washing and just prevention of transmission of an infection that may have been picked up potentially on farm. You obviously don't want to bring it home and infect others in the family, and then beyond that. Also to have this same sense of stewardship at the GP. I mean, if in the past there's been a suspicion that maybe people, when they're sick, sort of have this expectation of getting an antibiotic and that actually influences the GP to prescribe it, don't go in with that expectation. Discuss whether or not antibiotics are actually necessary. So it's all part of that sort of behaviour change and opening up a discussion, having that conversation and doing things cooperatively. Similarly in veterinary practice, the AVA, Australian Veterinary Association, is focusing on this area as well. Nowhere in the world are there formal antimicrobial stewardship programs at the practice level, either in medical or veterinary. So we're hoping that over the next couple of years we can roll out a program in veterinary practices for all species. And in human hospitals, where antimicrobial stewardship programs are in fact now compulsory if you want to continue to get funding from the government. So I think that it started, there's a lot of momentum in this particular area, and it will continue, and I think it has to be adopted with greater interest and enthusiasm and motivation in the all areas of animal health. And I think here, just an article from the Journal of Hospital Infection earlier in the year, sort of talking about how you can get significant improvements in the MRSA prevalence in hospitals by introducing these stewardship programs, where people are looking much more carefully at how antimicrobials are used and also at infection control. So with teamwork and accountability and ownership of the use of antimicrobials, things can improve. Not assuming someone else is taking responsibility. Everyone, we're all part of the same environment. We all need to take that responsibility. And then the benefit from this is that all stakeholders see themselves as stewards of these agents, and then applying just continuous improvement means that this antimicrobial resistance situation is going to be attenuated. It's going to be delayed. We're going to be stopping any particular growth. So I think in the human area, not on the human area, it's sort of one of the key textbooks of antimicrobial therapy in the veterinary world is this particular sort of tome, textbook, and it has a chapter on antimicrobial stewardship, and it points out exactly what it is. We don't need to dwell on it now, but certainly encourage everyone to look at the elements of antimicrobial stewardship. And it's broken down basically into 5 R's. I'll just go back. And the R's are taking responsibility for the use of antimicrobials and then borrowing from the animal ethics area and animal welfare, sort of an area that you've all been dwelling in for more than a decade. And I think a lot of the initiatives that you've introduced into feedlot practice and management based on animal ethical concerns have also probably improved the resistance of those animals to infection and also contribute quite significantly to improved antibiotic use and antimicrobial stewardship. So borrowed in this particular model from the 3 R's of animal welfare, sort of reduction, refinement and replacement. We can apply each of those to antimicrobial use. And then there's this review step at the end. So this is sort of just to ensure that there's a continuous cycle. and re-examination of just how antimicrobials are used. And I think everyone in the feedlot should feel free to talk to others and the decision makers, maybe the veterinarians that are prescribing antibiotics, talking to the feedlot managers and others just about infection control programs, just to ensure that every use is in fact justified, as I'm sure it already is. And so it's just sort of implementing sort of appropriate use of antibiotics and making sure that there are feedback loops. So you just assess continuously response to treatment or any measure that you've introduced to improve the health of the animals, and then learn from that before going to the next step. And I think what's often handy, and I mean the many examples of changing human behaviour by providing feedback. And I suppose one of them in Sydney, when there was a drought, everyone thought that people would just continue to use water as much as they wished and hose their gardens and wash their driveways, etc. But they didn't. You know, when their bill reflected exactly how much water they were using and how much their neighbours were using, it influenced then that behaviour. And even when the drought ended and there was plenty of water around, those behaviours in most parts of Sydney have become entrenched. I mean, the same sort of thing can apply in many other areas, whether it's electricity use, etc. If you have information about what you're doing, if you can benchmark your practice against what someone else is doing, and you can see that there are widely different practices, it gives you an opportunity then to go in and explore and decide, well, how can we actually do things better than we already are? So this is just the 5 R's. And one area that I emphasise quite a lot in reducing antimicrobial use and also refining it is better diagnostics. There are limits to a lot of the diagnostic methods that are used at the moment, plenty of opportunities for improvement. The technology is not necessarily there immediately, but you know, it's developing. And then replacement, of course. More and more vaccines are used, and people outside the feedlot industry and outside the livestock industries as a whole have no idea just about how important vaccines are for production, just the breadth of the number of vaccines against sort of viral and bacterial diseases and protozoal diseases in some species as well. But a lot of the health of animals is absolutely dependent on those vaccines. And, you know, I think solid underpinning of the health of animals is based on that, and biosecurity and a number of other measures that perhaps aren't as rigorously followed in human hospitals and sort of GP practices as they are in animal production. The theme that I'm trying to develop here, I suppose, is not just antimicrobial use, but also infection control, because the infection control, removing the driving force for use of antimicrobials, should in itself sort of have a significant impact on driving down the likelihood of antimicrobial resistance. So this is, just an outline of initiative that the Australian Veterinary Association is putting together at the moment. Just trying to make something that's very practical, can be implemented, not interfere with sort of normal hectic schedules, but nonetheless allow practices to take responsibility for what they're doing and have someone sort of charged with making sure that this particular program continues to work at the practice level. So it will involve some behaviour change. It'll involve those 5 R's and continuous improvement. And all these things, in a way, have a counterpart in the QA programs that you already have in place in feedlot practice. And one of the things that, has mystified me is just how, it's more than 150 years ago since Semmelweis, first drew the world's attention to the fact that washing your hands can actually save lives. And yet, even today, hand washing is very much suboptimal in all aspects, whether it's animal health, veterinary practice, hospitals, etc. I mean, it's such a basic thing. Even before people knew about what bacteria were, it was recognised that if you wash your hands, you can actually make a serious dent in infection. And if you're not infected, then the need for antibiotics is going to be reduced. So many campaigns, talking about trying to promote hand washing. I mean, in India, at schools, trying to change behaviour, and sort of there's a recent program trying to change the behaviour of people, and it has to be very much directed at the cultural messages that are necessary. And here you can see the sort of the nasty uncle who, he's responsible for making the meals, and what they're trying to do is introduce this yuck factor, so that if anyone doesn't wash their hands, not seen to wash their hands, is considered sort of to be an outcast. So it's having some impact already. Hand washing after 6 months after this program was introduced sort of went up about tenfold and seems to be sustained. And in Peru as well, just trying to engender this sort of philosophy and behaviour of hand washing in parts of the world, including Australia. We could probably benefit from some of these initiatives as well. So just sometimes the simple things, the basic things, can have enormous impacts. I don't need to dwell on this in the interest of time, but I just had a few examples of just where infection control and knowledge of how diseases are transmitted can actually have an enormous impact on trying to contain an infection and thereby alleviating the need to then intervene with, potentially with antibiotics. Maybe not for equine influenza, but it was just that here was a disease that was introduced into Australia and quickly eradicated just by applying the principles of infection control. So I think, just highlighting that you already are familiar with farm biosecurity and it's, the key elements of farm biosecurity, each of which is going to reduce the level of infection and the need for antibiotics. If they had some sort of biosecurity manual for other industries and even for, as they're being developed, and even for companion animal practice, all these things make a major contribution. So I think disease spreads, by plane. People are very mobile. To get living animals or meat, food into Australia, generally there's quarantine intervention. It's not applying to humans. And the impact of this, I mentioned before about MRSA, that's actually been introduced into Australia, most likely by an Australian visiting Europe, has brought it back and then introduced it onto pig farms. So I think, that infection control and biosecurity likely to ensure that incidents like that are going to be less frequent. But certainly, going on feedlot visits to other parts of the world, you've got to be cognizant of the fact that, when you come back to Australia and visit your own properties, that there's always that potential. But, because of our biosecurity mentality, we're aware of that and we can make sure that it doesn't happen. So I think in concluding, obviously have a few too many slides here, but I'd like to just emphasise this essential message of collaboration. It's a collaboration between all of us. All of us are part of the same environment. We all have a piece of the puzzle, which together, can ensure that we get a solution to this issue of antimicrobial resistance and antimicrobial use. I think what we're doing already has made an enormous contribution to keeping resistance levels incredibly low. Last night, just in my final minute, I was fascinated to hear about the Feedlot of the Year award and the fact that it's now been going for 20 years, because those 5 key criteria for selecting the Feedlot of the Year all could in fact apply to antimicrobial stewardship. You've got QA culture that's now well entrenched. It's had more than 20 years to permeate the industry. Interest in product integrity, environmental responsibility, animal welfare and corporate responsibility. All of these are in fact the basis of antimicrobial stewardship. So it'd be very easy in my view to actually introduce antimicrobial stewardship into this program without actually it being an impediment to anyone, causing a significant amount of extra work, etc. And the benefits would be to describe to your clients and to others that you're actually taking this issue seriously, even though there's no crisis. We still take this issue seriously, and look what we're doing. So I think, So my final words are, just in answer to the topic of the talk, what does appropriate use look like? I think it looks like collaboration, it looks like stewardship and the 5 R's that I talked about. It's this One Health approach where the same principles should apply throughout that environment, and maybe considering whether antimicrobial stewardship has a role to play in future Feedlot of the Year exercises. So thank you very much.
Thank you, Stephen.